Hi, I'm Maitre. The course of teaching and learning and their concepts have guided me to lead a uniform and systematic approach with new insights towards my patients, with giving me a strong background of evidence based clinical research and practice. Teaching and learning principles essentially becomes an integral part of the treatment strategies for every patient. We, as our physical therapists, teach our patients to integrate those learned skills into their daily activities. This course provides with concepts and theories that are proven, unique, and innovative, with good research and skills that can serve exciting and reflective physical therapy practice and let us build a hallmark of our doctoring profession. I always thought of teaching and learning skills as essential and critical part of patient-therapist relationship, yet challenging to acquire and integrate into the practice. With the philosophy presented in this course and with now be able to transform it into practice application on my patients, it has left a benchmark for newer strategies and I now observe radical changes in the treatment outcomes of my patients.
Hello, my name is Siva Sankaran. I'm going to share my thoughts about the class Teaching and Learning in Healthcare. I took this course for my transitional doctor degree in physical therapy at Wayne State University in Detroit. If you are in healthcare profession, I suggest you enroll in this course. I'm very sure that you will learn a lot about the learning styles of your patients and peers, and also how to communicate and teach effectively to your patients and to your students during their clinical rotation. Personally, for me, this course has given a good structure to my knowledge base about learning and teaching. The theories of teaching and learning have added more clarity to the bits and pieces of information that I have learned from my undergrad school and my own experience from teaching and from interacting with my patients. I have gained insight about various instructional methods, different domains of learning, and theories explaining how to enhance health behavior change. A couple of nice things I have learned in this class is how to make an effective and efficient PowerPoint presentation and how to do a great visual presentation using a concept map. To become an expert physical therapy clinician, one should excel in teaching to diverse group of patients from various age groups with diverse learning preferences. This class has helped me tremendously to reflect on my own learning preferences and how I could improve my learning and teaching skills using the various concepts and theories I have learned in this class. At the beginning of this class, I have expressed that learning and teaching is a collaborative process. At the end of this class, I have learned how this process can be streamlined and improved. Overall, I would say this class has positively influenced my teaching skills and enhanced my learning process. I am sure it will do the same for you.
Hi, my name is Susha Thomas, and I am a physical therapist currently doing my transitional DPT at Wayne State University. Physical therapists incorporate teaching in their daily practice, teaching patients proper techniques for transfers and safety, teaching caregivers, teaching physical therapist assistants, and teaching students. By teaching others, I'm able to combine the love I have for physical therapy with my enjoyment of helping others in their road to recovery. The material presented in this course gave me the tools to get to know the patient better, to understand what type of learner he or she is, so that I can adjust my treatment approach accordingly. For example, if my patient is a visual learner, I try to provide illustrations, demonstrations, and video feedback to enhance learning. The teaching and learning principles are very important as they provide a guideline for teaching for different populations. For example, if the patient population you treat is mainly adults, teaching should incorporate involving the learner as much as possible in formulating the objectives and creating an environment where learners feel safe and comfortable in expressing themselves. The principles of teaching and learning also emphasize on self-efficacy and reflective practice, both of which are crucial in physical therapy. This course will provide a foundation for effective teaching methods and give you the tools that will help you in your practice as a physical therapist. The various theories and models presented for behavioral change will help you understand the learning stages of your patients. This course will also provide tips for an effective PowerPoint presentation, which most of us use as a tool for delivering in services or training colleagues. This course also covers the basics of teaching and understanding the audience first. At the beginning of this course, I was pretty new with the teaching and learning philosophy. This course gave me the confidence and ability to effectively teach both patients and colleagues, and even gave me the confidence to become a clinical instructor and start teaching my first physical therapist student. I still highly depend on reflection in my treatment approaches, but I also incorporate patient perspectives and their learning style in my plan of treatment. Keeping the patient first, understanding them, and respecting their ideas, views, and culture will provide an effective teaching and learning experience. Thank you for listening.
Marilyn Raymond and Ben Clark, instructors of the course Teaching and Learning in Healthcare, have provided me with a different perspective on various theories and principles and how they relate to my profession of physical therapy. The course has allowed me to identify different learning styles and adapt my teaching method accordingly. It has encouraged me to adopt a more learner-centric approach as a clinical instructor. The course addresses advancements in instructional technology, various health behavior change models, patient adherence, and components of leadership. It also has provided me with a patient-centered assessment and research tool like Promise. Overall, I feel more knowledgeable and better equipped to utilize various teaching and learning strategies in my practice as a clinician and a clinical instructor.
Hi, my name is Rikin Shah. Physical therapy is a service oriented profession. I believe in physical therapy teaching and learning a lifelong process. From this course, I explored the potential of new teaching and learning concepts in physical therapy practice. A major component I learned from this course is the importance of the individual professional role as an educator. As a physical therapist, we are involved in wide variety of teaching activities such as teaching students, patient, family, community and other professionals. That indicates teaching is an important skill in the practice of physical therapy. Patient-centered practice is the hallmark of growth into achieving clinical mastery and establishing relationship with patient, which in turn can serve as a foundation for teaching and learning in therapy. The other important component is self-reflection on personal experience and development as a professional. In clinical practice, patients are most influential teachers for us in the practice. Every day I learn something different from my practice, which is very valuable to me. Teaching and learning is learning to work with my patients and with my peer groups, which enhance my learning and professional development. Now I learn more about patient practitioner model and health behavior change theories. Therefore, I think self-reflection is the most important for learning because experiences provide a foundation on developing professionalism. Moreover, our personal and practical approach reflects our own teaching and learning in physical therapy practice. The attitudes held by therapists would greatly influence his or her practice. I think every therapist should enroll in this course. Teaching and learning helps me to understand people's experiences and to facilitate therapist-patient relationship, which in turn help me to develop myself to become a better physical therapist. Thank you.
Hello, this is Bill Thornton, and my first attempt at a podcast. I think I'm going to try and briefly touch on all the questions. Why should we enroll in this course? Or who? All of us. Everybody who's a physical therapist and the instructors. This course has made me much more aware of my learning style and how it may affect students who have various and or different learning styles. I believe it's important that we do this because we have a huge influence on our patient's life. This should take place early in a therapist's career so that we don't really let them develop bad habits but keep them open to learning. I became very aware of how important problem-based learning is. I'm a huge fan of it, and I think we need more of it in schools. Less teacher-focused and more patient, or I should say student-focused problem solving. It's been a great course, and I really enjoyed the 2 article reviews if I had to pick one thing that I really learned from. I think my time's up. Thank you.